Hello, check, check, check. Mic check, 1, 2, check, check. Alright, what up, what up? Welcome to the Railcast. It's your host, DJ Rail Life. And today is April 2nd, which is National Autism Awareness Day. And April also starts Autism Awareness Month. I'm here today with, you can say your name.
Hi, Lanisha McMillan-Turner.
Alright, and today we're going to talk about autism. I tried to do this last year by myself, and it didn't quite work the way I wanted to, because I got kind of emotional with my son, and really couldn't express myself the way I wanted to, so I decided to get some help from you.
No problem, no problem.
So, also before we get started, just want to say, what's up to my listeners, to our listeners, I'm sorry, and Spotify, and Anchor, and also YouTube. You can check us out there. Just type in the Railcast, and we'll show up. Also, an Overcast, and also if you have an iPhone, iTunes, it's available there as well. So, let me see. What do we want to start off with first? Let me ask you. I guess to better explain it to people who don't know, people unaware, what exactly is autism?
Okay, so I'm an occupational therapist, and I've worked with children with autism for many years. I've been an OT for about going on 15 years now. So I've seen many children with autism. It's a developmental disorder. It can be characterized by so many different things. It could be characterized by behaviors. It could be characterized by developmental delay, speech delays. All of those things can characterize autism. So it's there's no one set examination or test or blood test that can test and say, boom, your child has autism. So there's several different ways to diagnose autism. It's usually through a pediatrician that does some developmental testing.
Right.
And kind of just take a look at their behaviors and different things, different characteristics, and then you end up with a diagnosis of autism.
Right. What age are some of these characteristics picked up on the child? What age are they noticed?
Now they're diagnosing as young as 18 months.
Wow.
When I was in school, when I first started to learn about autism and occupational therapy, it was about 3 years old. Children were 3 years old when they started to diagnose children. But now, doctors are diagnosing as young as 18 months.
Wow.
Yeah.
I didn't realize that. My son got diagnosed when he was 2.
Mm-hmm.
When we started seeing some of the things he was doing with his, verbally.
Mm-hmm.
He was speaking, but it wasn't making sense. It was making sense to him.
Right.
We were asking what he was saying, and he would get frustrated. He would say the same exact thing the same way. But 2 years old is when we noticed, his activity was a little bit different than normal.
Yeah,
So,
it's frustrating for the child as well.
Right.
It's frustrating for the caregiver and the parent, but ultimately for the child as well, which explains a lot of the behaviors and the frustration that may come along with the diagnosis of autism.
right. What are some of the behavior and the characteristics that you notice with all forms of autism?
One of the biggest ones would probably be social interaction. So a child may not socially interact with other children or other adults, for that matter, the same way as a typical child may interact. You may see repetitive behaviors such as flapping or auditory repetition of certain words or activities, lining up toys and different things. Poor eye contact may be another sign of autism or autistic behaviors. There's many things. But one thing that's huge that a lot of parents don't realize with autism is sensory integration disorder, which doesn't necessarily go hand in hand, but a lot of times you see sensory integration disorder with children that are diagnosed with autism. And that is basically a child seeking or trying to stay away from certain sensory inputs. So you may see one child bouncing off the walls and, touching hair or, just really fixated on some type of sensory input, and then another child might be kind of trying to stay away. They don't like the auditory input, or they don't like specific textures in their mouth, or they don't like to touch sand or different things. So that's one big thing, that a lot of kids experience, and I see a lot of kids with those disorders as well.
Right. Yeah, my son, he has a mild condition.
Mm-hmm.
So he's verbal. He's come a long way due to, therapy in school, and also his tablet. I got a tablet for him maybe 4 or 5 years ago. And I did some research on it, and they said that's one of the things where it can help a child with special needs, help them with the communication. Mm-hmm. So do you still see that as well, as far as iPads or tablets, is that a source to help out kids with autism?
Sure. So there's several, depending on what developmental delay you may be working on. So there's, the iPad is amazing. There's so many things and so many apps that you can download. So if there's language deficits, there's an app for that. Or if there's fine motor delays, there's specific, apps you can use to kind of enhance the fine motor ability of a child. So yeah. And also, they like to, a lot of times, children with autism like solitary kind of activities. So because of the social, interaction or lack thereof, they like the solitary activities. So that's another way to kind of, help them kind of, stay in their bubble sometimes, if that's what they choose to do at the time.
What's the most severe case of autism that you see with a child as far as their condition?
Usually the most severe case is usually the child with no verbal communication. It can manifest in a lot of different ways. So when you can't communicate, just imagine not being able to say what you need to say or speak or communicate. One can become very frustrated, which can really translate into a lot of the behaviors that you see with a child with autism. Now, this is not typical. There's no typical case for autism. No two children are alike in any way.
Right.
But usually, if there's a severe communication disorder, as well as sensory processing issues, those two together usually, produce some very severe behaviors and needs a lot of therapy and input from different places.
Right.
Yeah.
What will you say is some of the misconceptions of children that has autism?
That they're not smart.
Right.
It's a mental disability, and that they're going to struggle with math and science and things like that. I find that children with autism need structure. When things are the same every day and the routine is followed, they thrive. But when you may throw something in there that's not
right.
you, you open up Pandora's box, right? So it's not that I find that children with autism are very bright and very intellectual and very, if you give them, they excel in things like math because it's very rote. There's no ambiguity to it. It's 2 + 2 is 4. 4 + 4 is 8. And so they thrive in those type of scenarios. When there's more ambiguity and problem solving and things like that, it may be a little bit more difficult. But the biggest misconception, sorry about that, is that they're not intelligent or that they're not bright.
Yeah, definitely hear that a lot.
Yeah.
And some people figure that they're slow, that so on and so forth.
Yeah, I had a student the other day ask me what's the difference between mental retardation or intellectual disability, we call it
That's
now,
a good question.
and autism. And it's like two completely different things.
Yeah, because a lot of people put that together. Once you hear the word disorder
or disability,
a lot of people put it together as,
yeah,
they're the same.
And a lot of times what I notice too are autistic children or children with autism look typical. They don't have a specific look like children with Down syndrome or children in a wheelchair or whatever the case is. So people tend to think that autism is not real. You just need to discipline your child. You need to learn how to control your child in public situations and things like that. But there's no look, there's no face, there's no, there's no typical autistic child or a child with autism. There's nothing typical about it. So it's very hard sometimes for parents and caregivers to manage that because you go out into public and people may not understand or may not be
Yeah, because my son sometimes in public does things and like you say, they don't have a look to say, hey, I'm autistic. So they look at him sometimes like, what are you doing? Like, they give you that look. They may not say anything, but they get that look. You said something earlier about discipline. What would you recommend?
That's rough.
Yeah, I know it is. Being the parent of one. Like, what would you suggest would be a good way to discipline a child that's autistic? Because you can't do, you can't do what you would do for a normal kid. Like, so what do you suggest?
So, like I said before, structure and routine are your best friends when it comes to children with autism. Being structured and being understanding at the same time is really important. Like you said, you're not going to discipline a typical child the way you would a child with autism. So preparing a child prior to doing something that's not in their routine or preparing them for a specific thing. So this is what's going to happen. We're going to grandma's house, right? You've never been to grandma's house, but you're going here. We're going to stay here for this amount of time. You're going to see X, Y, and Z, and this is what's going to happen, okay? And preparing them, even if it's days before or the day of, but you have to prepare children with autism for whatever situation. Typically, the behaviors begin when they're either frustrated or there's a break in routine.
Or in JJ's case, when he's hungry.
Yeah, that's me too.
If he's hungry, he's not going to be good.
Yeah, and if that's another good example, if they eat at a specific time, keep it consistent. If they go to school at a specific time, just one thing can really throw off the routine. So to limit some of the behaviors, just try to keep it as consistent. And if there's nothing wrong with doing something different, but if there's something that's going to be thrown into the routine that's different, prepare them for it. Talk to them about it. And this is what's going to happen. At 1 o'clock, we're going to do this. I know we typically do this. We're going to do that. But we're not. We're going to do this. And if you do this well, that you will get reward them for good behavior as opposed to kind of disciplining them for behavior that's not socially appropriate.
Right. That's one of the things, I'm glad you said that about rewarding. That's one of the things that I read on early on is, when your child do something good, that, hey, good job, you did this or you did that, and give them a reward for it. So they kind of understand what to do. Once they keep doing the same thing, they understand, okay, if I, put my shoes up the right way, I have to continue it. Every time I come in the house, take my shoes off, I got to put them in, the right way. So that's good that you said that. Yeah. Get to one of the big questions that a lot of people have a question about is, you already know.
Vaccinate, the big V.
The big V, yeah. So,
vaccination.
Yeah, it's like over the past couple of years, it's been this big thing about not getting your child, vaccine, and that's one of the reasons of children getting autism. What do you know about it? And, is it true? Is it good to not get it? Or what, what's the, situation with it?
That's been the lifelong question, right?
Question.
The $1 million question. So there's a lot of research going on about vaccines and autism. The CDC just recently did one that said that there is no link between vaccinations and autism. However, you cannot negate what a parent tells you this child got vaccinated on this day, and the very next day or the very next week, I saw a difference in their behavior. I've had parents tell me that it was directly correlated to this vaccine for them.
Right.
For them. I am not a researcher nor a medical doctor, but the CDC is saying that there is no link between vaccinations and autism. But, that's some parent's story, right, that, my child was vaccinated and then this is what happened. Mm-hmm. So, take it as you may. But the CDC is saying, and there's other things that they're studying. There's genetics, there's environmental factors that are being studied right now. Lots of different things. So, there's no real known cause to autism right now.
That was going to be my next question for people that want to know what are the causes of autism. If it's not, written in stone that it's vaccines, what would be some of the causes of autism?
There's so many different theories out there right now. Some people are saying environmental. Some people are saying that it's a genetic thing. Some people are saying it's the diet. Some people are saying it's, the vaccines. There's no known cause to autism right now. But there's a lot of research going on to try to figure out what the cause is and possibly a cure.
Right. And that was going to be one of my next questions as well. I've always heard that it's not a cure because it's not a disease.
Right.
It's just something that you have to learn to cope with. Mm-hmm. So do you think it would be a cure or something, to maintain it besides medication, which is not, good as well, depending on, I guess, the condition of your child. So do you think there ever will be a cure or anything to help it?
I don't think, I feel like that's a rough question because it's, like you said, it's not a disease. It's when a child just develops differently from what's typical. So what are we really fixing? Right. What is really typical? I don't think there is any typical. I feel like everybody is so different. It's kind of hard to say, I'm going to fix this child to make them like everybody else. Well, what is everybody else? You know what I mean? Right. There's no typical. We say typical and atypical behavior because this is what's usually done to kind of create that, what is usually done in this kind of setting. That's what's typical. Right. Atypical is those behaviors that are not typically done in a situation. But I think there's definitely ways to manage. I think communication is a huge part of being able to manage autism. Speech therapy is really big for children that can't communicate. OT, of course. It is OT month. Shout out to OT.
Shout out to all OTs out there. What's up, Cousin Shelly? Cousin is OT. What's up?
Nice. But just being able to address those developmental milestones and those developmental issues that may arise from it. Being able to address the outliers, being able to address the things that may affect their environment and their interaction with their environment is the best way to address it, in my opinion. And just being able to know how to kind of give parents the information they need to know how to manage. Right. Because it's not easy. It's not easy, especially depending on the degree of autism that your child may have. It's very hard to manage, So being able to equip parents to be able to manage whatever it is they find hard in their routine and being able to help the child to be able to meet those developmental milestones, whether it be cognitive, whether it be motor skills, whatever, just being able to help them to be able to function and to be able to be where they need to be developmentally. And, I've seen right now there's several stories about, kids with autism going to college and being the first basketball player and being the first lawyer and they can be whatever they want to be just like anybody else. It's just being able to equip the child and their caregivers with the right tools to be able to manage.
Where can people listening, get those tools from?
Oh,
Whether you're parents or whether you're, that's one of your loved ones. Like, where can they get the information to help them with that?
Well, we have several Dr. Googles out there. They Google everything and try to get as much information as they can online. But talk to your doctor. Talk to your therapist. If you have a therapist that your child is seeing, talk to them about tools and things that they can do at home to help incorporate what you're doing at therapy. Because a lot of the times, you'll hear people say therapy doesn't work. Well, are you incorporating the things that they're doing in therapy at home? Right. Because I don't have a magic wand. I wish I did, but I don't have a magic wand. I can't fix your child. I can give you tools and we can do things to help, to help catch your child up developmentally or, address whatever deficits they may have. Excuse me. But there's no magic wand. It has to be, a concerted effort. Right. With the healthcare providers, with the parents, with the schools, and, everybody just chipping in to make life as normal, as typical as we can for our children.
Right. And being that social and communication skills is a huge issue with autistic children, what do you think about them being homeschooled?
Personally, I don't think it's a good idea. Just because we can't live at home forever. You know what I mean? We have to integrate. We have to kind of be able to function in the world, because I tell parents a lot, so you won't be here forever, right? We won't be here forever. Our kids will hopefully outlive us. Right. So what have we equipped them with to be able to live without us, right? So social skills is very important. If you feel like your child is just completely just can't function, it's just torture for them to be in a classroom setting or in a public setting, then of course do what works for you. But you can't avoid social experiences forever. So if you are at home, if you do choose to homeschool your child, you have to make a very good effort at putting them in social situations, whether it be social groups, play groups, taking them to the park to interact with other kids. That you have to, you have to interact. So if it's not through school, even if you have friends and family that, you want your children to interact with, you have to give them those opportunities to do that. If you do homeschool and you feel like your child flourishes and learns, go for it, whatever works for your child. But you can't avoid social situations. I think it's more detrimental to try to avoid social situations for your child, because when they get older, it's going to be more difficult for them to, as an adult, to kind of, to be able to kind of function in the social world. Right.
And what would you recommend for a child that, basically to help them read? Because, everything with kids with autism is that it's memory. Mm-hmm. So they can look at a word and say cake, but will they be able to spell it out and actually read it instead of just looking at the word and just remembering what the word looks like? Mm-hmm. So how would a child be able to really sit there, understand, and read, as opposed to just memorizing the word that they see?
That's a good question. So like we said before, structure and that rote kind of teaching is, in my opinion, the kind of best way. So you have to kind of start from the beginning, learn the alphabets, memorize the alphabet, that's fine, just like a child would. Right. And then, put those things together phonetically. You have to kind of start from the beginning, because like you said, you can read a book to a child with autism about 3 times and then give it to them and they can probably read it back to you because they've memorized all the words, right? So, and that's fine, but you do have to start from the beginning. Don't miss any steps. Start with the identifying letters, and then start with phonetically sounding out those letters, and then putting those letters together. And but you know what, it's surprising, because so many people, you'd be surprised at how many people can't actually read.
Right.
Just typical people. They memorize words, and they memorized things, and kind of put it together, and gotten through high school and everything else, not knowing how to read. So just as you would teach any child, start from the beginning, start with the letters, start with the sounds, and go through that. But it's nothing wrong with them memorizing words.
And being it is Autism Day, how do you see, I guess, the awareness of autism? Like I noticed the last couple of years is picked up dramatically, which I'm happy for, because before 11 years ago I didn't know anything about it.
Right.
Like I grew up, there was nobody around me that had autism or in the family. So how do you like the growth of it as far as awareness?
I feel as if it's being diagnosed more than before. Like I said, when I was in school, I think the ratio was like 1 in 82. 1 in 82 kids were diagnosed with autism. Now I think it's like 1 in 59. Yeah, yes. It's 1 in 59 now. So I think that it's being diagnosed at a higher rate, and people are paying attention because it's affecting them now. If it doesn't affect us, we don't really pay attention to it, right? So now it's affecting our children, our classrooms, the patients we see, our families, our churches. It's affecting us. And so now people are paying more attention and saying, okay, how can we help? How can we manage this? How can we integrate children with autism into our schools, into our churches, into our sports teams, and into different things, so people are paying attention, and I think that's a good thing. I think that's a real positive thing.
Right. And again, I'll read those stats again. What did you say it was before? It was 1 out of 89 before?
It was 1 out of 80 something when I was in school. It was just, and it was more boys than girls.
Right. So
and now
it's 1 out of 59. Looking at the stats right now, according to the Centers of Disease Control, it's estimated 1 in 59 children in America.
Wow.
Yeah.
Yeah. And so more money is being spent on it too. So now people are really paying attention. Healthcare is now paying more attention, because now more money is being spent on diagnosing, treating, providing care for children with autism. So everybody is, paying more attention to it.
Which is good. Definitely.
Yeah, definitely good.
Right. So tell everybody the name of the place that you work now.
Okay.
And what you do with autistic kids. Anybody that's in the South Florida, South Broad area.
Yeah, so we are Therapy Out the Box. We're located in Pembroke Pines. We definitely provide occupational and physical therapy for children with autism. What we do is just depending on the child's needs. So we provide care based on what the caregiver is saying they're having difficulty with, what the child may have difficulty with, whether it be developmental delays or growth delays or whatever the case is. It's very specific to the child's needs. There's no one treatment that we do. If a child comes in with sensory issues, we work on sensory integration. If they come in with fine motor or coordination or balance issues or even social issues, we work on that. So just depending on what a child needs.
Okay, and give them the name and address again.
Sure. So we're Therapy Out the Box. We're located at 12251 Taft Street, Suite 302 in Pembroke Pines. We can be reached at 954-951-0974 or www.therapyoutthebox.com.
Okay, good. And I also want to say before we go, anybody that's, a parent of autistic kids, there are a lot of role models and influences out there for people in the same situation, like Holly Robinson P, Tony Braxton, their child, went through the same thing or probably worse.
Mm-hmm.
So, all the parents out there, or even family members of loved ones that, that may be frustrated and don't understand, they could do the same thing these people did.
Right.
Go, get your research. My son was the same way. Like I said, he was diagnosed at 2.
Right.
Ever since then, in school, he's been having OT twice a week,
Right.
A speech therapist twice a week, school, and also, like I said earlier, the tablet. And also television, him being around with the kids helped as well. So now he's, come a long way. He doesn't shut up now, actually. So, but,
yeah, and for parents too, there are support groups.
That as well.
If there's parents out there that need support and need help, speak with your therapist to get resources about support groups that may be out there, because there's support and there's help. It can be draining. And it can be very difficult. So, your child needs help and support, but don't forget self-care for your caregivers and your parents. Seek out the help you need. It's out there.
Absolutely. And just know that your child is, he's different, but not less.
Absolutely.
This order doesn't define who they are. And also that just realize everybody they don't have to, understand your world, we have to understand theirs.
Absolutely.
So once you realize that, and just have patience with your kid, and things will hopefully get better. Like you said, you could talk to your doctor.
Mm-hmm.
Also, different places like Autism Speaks.
Yeah.
They have information and different research that autism. So
yeah, and also in the Broward area, Nova has a card center that definitely has a lot of resources there. And get the help that you need for you and your child.
Absolutely. Well, I'd like to thank you again.
You're quite welcome anytime.
Yeah, a lot of information is definitely useful. Hopefully everybody listening, can take use of this information. And again, you can follow me on the Railcast YouTube. You can subscribe, and every time we get a new episode, you get a notification. Also on the Anchor app and Google Podcasts, iTunes, Overcast, and Spotify as well. And I'd like to thank you again.